Hello, everybody. Milo Legendre here, founder of Chartara Labs. I wanted to present some new updates to Chartara Notes, the AI scribe and visual analytics platform that I developed from my doctoral research in routine outcome monitoring and evidence-based practice. And so, as you can see, the first thing you see when you log in is the documentation system. I want to be clear about what this is and what it isn't. This is not a progress note writer. It's a general AI documentation assistant for any professional behavioral health documentation you need. Progress notes, treatment plan updates, disability forms, prior authorization requests, anything you write as a clinician. It is quite the workflow efficiency hub for behavioral health professionals. The philosophy behind it is important. There's no session recording. There's no ambient listening to client sessions. At Chartera Labs, I don't believe in putting AI in the therapy room, and this belief is informed by my vast experience as a licensed mental health counselor, working across settings in the human services and pursuing higher education in behavioral health in general. So I don't believe in putting AI in the therapy room. I believe it's invasive for the client and compromises the therapeutic relationship. And it could also have implications for the therapist in their own work and how they conduct the work. So at Chartera Labs, you get a different option, um, a more ethical option when it comes to the integration of AI in the behavioral health field. But having said that, the clinician instead speaks after the session if you're not doing some other form of documentation, such as um, a treatment plan review or a disability request form or what have you. So you have 5 minutes to dictate what happened in your own words. You retain your own clinical voice, which is important, and the AI generates the documentation around your input, not around a recording of your client. And it's fully customizable, which I'll show you now. So you can create any template your organization or practice requires, any format, any documentation type, not just clinical notes. And the underlying AI is trained on how to give you a professional, efficient piece of documentation for your workflow. So if we wanted to create a new template here, you'll name the template, whatever you need to name it. Then you can select the template type, okay? And this is important because the template type is going to be how you're talking to the AI. This is essentially the directions that you're giving it on how to train it for the underlying system. It really helps you be able to ensure that the documentation is proper according to your needs. So there's a set of drop downs right here, but you can also input anything you need to in this text box, and the AI is going to take that and generate an efficient, accurate note for you. So then you'll put in any sections you need. Okay, you just put in, you can add as many sections, whatever your headings are for whatever EMR you're using, and then you can also set it as your default if you want. So I've also done an example in a previous video of what it looks like to actually generate a piece of clinical documentation. So you can refer to that video on the Chartera Labs YouTube. But again, this is the updated user interface. This is the most updated version of the platform. So now to the visual analytics. This platform is unique. It's quite the workflow efficiency hub for therapists. You have your AI scribe that generates any documentation that you need. It's fast, it's efficient, it's impactful, but then you have the visual analytics. So what we have here is a selected suite of 6 high-impact data visualizations: treatment plan review compliance tracking, caseload breakdown by diagnosis, PHQ-9 and GAD-7 longitudinal outcome tracking per client, risk level tracking, and a client no-show machine learning analysis. Each one generates an instant PDF report. The philosophy here comes directly from peer-reviewed research. Therapists engage more meaningfully with data when it's presented visually. And through my own development of the platform, as I was putting the research synthesis together and archetyping the early versions of the platform, I personally believe that when a therapist uses data visualization, it creates a motivating experience for them to enhance or to engage more meaningfully in routine outcome monitoring. So, data visualization is the core innovation here, and it's all backed by peer-reviewed research. I've effectively bridged research to practice through the use of technology, and this system right here is very impactful and can make a big difference for organizations, whether it's private practice and public health for supervision purposes or just tracking outcomes in general to be a more diligent and ethical clinician, holding yourself accountable, engaging in routine outcome monitoring. Everything here is free to access, HIPAA compliant, deployed on Amazon Web Services, um, built for enterprise grade scalability, and it's built by a clinician for clinicians. So I'm happy to answer any questions if anybody would like to reach out to me. But it's free to use, and I encourage you to sign up. Thank you.